name is Diara. I'm the Community Engagement Lead and Investigative Researcher with the U.S. team with First Draft. It is my pleasure to introduce First Draft's U.S. Deputy Director, Aimee Rinehart.
Thanks, Diara, and thank you everybody for joining. I help lead the U.S. office, and when we got started thinking about 2020, we said that we did a 15-tour training tour. We did 15 stops across the US. We were lucky to get all of those in before coronavirus happened. And when we were on tour, we would say we are going to cover everything that's related to the US election, including the census, including the Olympics, and anything in between. I thought maybe those in-betweens might be a hurricane or two, possibly, sadly, in the US, a mass shooting. But actually, life and history has taken over, and we were really swallowed whole, as I think everybody else was, by the pandemic. And it radically changed our work. We discussed on Tuesday night at 10 p.m. in March that we were not going to be going back into the office again, and we haven't been back since. So I'm sure most of you who are joining us on the call have also been working from home since March. And now our team, which usually has 3 offices, one in Sydney, London, and New York. Our team is stretched from California to India to Australia. And so we're lucky to have the team that we do. I want to thank our team for your being so diligent while also living through this. This is not easy work, as people on the call will quickly see. And you guys have been amazing. So thank you for your work. And I also want to thank Alistair Reed. He's our managing editor who has lassoed our team's work. And true to form, he's on deadline right now for 2 different newsletters. So much of the work that you see has been curated, edited, selected by Alistair. And we really appreciate his guidance on this. And again, if you're on this call, thank you for joining us. If you're here, you care about the information you see online. And so welcome. We are grateful for your participation, and we will pause through each segment so that you can ask questions if you want us to back up a little and explain a little bit more, because what we're going to share is going to be, I think, pretty amazing. First up, we're going to talk about an introduction to conspiracies, conspiracies that had started with the pandemic. Some are still ongoing, and Lydia and Carlotta from our London team is going to show us a little bit about the 5G conspiracy. 5G started, we had a couple of weeks of that here in the US, but it really took off in the UK. So Lydia and Carlotta, if you want to join us. Hi, guys.
Hello.
Hello.
And we would love to see the first slide. Great. Take it away, Lydia.
Yeah, so as Aimee said, they really took off in the UK, and 5G conspiracy theories have been around here for some time. But yeah, the pandemic really gave those people kind of new leverage. As you can see on the left, some people were claiming that 5G towers in the shape of the coronavirus were on England's £20 banknotes. And that formed part of the conspiracy theory that somehow the rollout of 5G was related to coronavirus. The online misinformation got pretty bad around late March, early April. And at the same time, phone engineers were being harassed, and there was some, sorry, I live on quite a loud street, and some phone masts were being vandalized. As you can see from the post on the right, that's someone calling for others to go and burn 5G masts in that area. So yeah, a really good example of how that online misinformation was having quite a real world impact. But yeah, the conspiracy theory here really does date back to when 3G and 4G were being rolled out. So while these groups were already there, the pandemic really gave them momentum to spread these conspiracy theories relating it to the coronavirus. But Carlotta might be able to talk to you a bit more about the rise.
Yeah, sure. So the way that we use like this social media data at First Draft, and the way I think they're really interested for, is because like in this constant chaos of mis and disinformation proliferating everywhere, it could like give you a look back at the whole picture instead of individual disaggregated pieces. So in this case, for example, we collected Facebook posts, both in public groups and pages that contained the word 5G as well as some coronavirus related keywords. And we analyzed day by day how many shares they were reaching. So there was a clear spike in March, which meant that the rumors about the 5G had left some of the fringe communities and small groups, and it was becoming quite mainstream. And so that was the moment where it was important to analyze and start reporting about the rumor. Another interesting thing that we noticed with some data analysis was that the rumor was quite extensively shared by some influencers, verified accounts, even mainstream media that were sharing the actual 5G misinformation. So that can give an ultimate amplification and make a lot of people talk about it. So in that case as well, it was very important to react quickly with some analysis and a report. I don't know if you, Lydia, want to talk a little bit more about this because you did a lot of research into these accounts.
I'm really interested, Lydia, in the next slide. We have a primary influencer in the UK, right?
Yeah, so this is David Icke. Lots of people from the UK will recognize him, but he's an ex-footballer, and he's really taken a strong hold in the last few years, I'd say, peddling 5G conspiracy theories and other conspiracy theories, sort of moving into misinformation about there being a global elite controlling everything. But yeah, you may remember, some of you, from earlier this week with the release of the Pandemic 2 video. David Icke was interviewed by London Real, who hosted that new video. And while it was shared like hundreds of thousands of times on Facebook, it was ultimately removed by YouTube and Facebook. Yeah, on the left, you'll see these are several anti-5G groups in the UK. It was quite interesting because lots of them were already on Facebook from around 2019, but this network of at least 75 groups all appear to share the same admins, the same branding, really hinting at like a coordinated effort to spread 5G conspiracy theories in the UK.
That's really amazing. Yeah, we didn't see quite that traction in the US, but it's amazing how it took off and had real life repercussions in the UK. I know Maddy also worked on some masks. From the next slide, we have something. If Maddy, you want to explain what we're seeing here?
Yeah, so I think when I talk to people about conspiracy theories, which I do a lot these days, I'm definitely a fun party guest, I find myself often like yes-anding, like, you know, somebody familiar with the internet will bring up something that's been in the news, like the 5G stuff, and be like, isn't that crazy, this 5G conspiracy theory? And I'm like, yes, but if you look at the origins of it and you look at the connections here and you look at who's promoting it, and I end up like that Charlie Day gif where he's got all the red lines from one picture to another. Because what we often see with conspiracy theories, why they're so difficult to tackle online, is that they are so interwoven with multiple communities. So here we see anti-mask sentiment, which we've seen rising in the US, and it's influenced political discussion, and it has a lot to do with policy and things in a traditional realm. We see taking on this deep state conspiratorial angle. And then I don't know if somebody wants to go to the next slide, that would be great. And then here we have two examples of anti-mask advocates promoting anti-abortion sentiment and pro-gun sentiment. So it's really difficult to isolate particular influencers for particular conspiracies because they are often entrenched in multiple communities, and they're often able to galvanize and network multiple communities, which makes them particularly dangerous. So yeah, it's not as simple as defining one particular conspiracy, figuring out who's promoting it, and taking down that bad actor. Things are a lot more democratized online now, which is tricky.
It was kind of a relief because oftentimes we look through it as we look at disinformation or information disorder through a left-leaning or right-leaning lens. And in this case, it was like a libertarian streak. It was like, oh, a new flavor of politics that we can start to look at. I don't know if that was similar to what you guys experienced, Lydia and Carlotta, where you were with the, I know there's an anti-mask movement in Italy and in the UK, but maybe you can explain a little bit from this.
Yeah, there's really like a huge overlap in the UK. Some of the posters for anti-mask and anti-lockdown events cited all of the like overlapping narratives, and like quite commonly came back to the civil liberties, you know, you're taking away our rights kind of messages.
And Carlotta, looking at here.
Yeah, sorry, I wanted to show this bubble chart that we just published along with the piece with Lydia and Ali from our team as well, which is basically about the day when the UK government announced that masks would have become compulsory in the country. And basically the no mask hashtag start trending on Twitter. It was the top 2 trends, I think. So we decided to look at the data behind this hashtag trending a little bit. And what we found out was that there were many people actually using the hashtag in a negative way. So basically opposing the anti-mask people and just saying like this message in the example that you can read here. So basically each blue bubble represents one of the pro-mask tweets that were tweeted along with the no mask hashtag. So as Lydia said, there is no doubt that there is a small and vocal community of people in the UK, in France, in Italy, in many countries opposing to mask wearing. And analyzing the data, they were also often spreading misinformation. And yeah, as you said, like these different conspiracy theories related to other 5G or anti-vax but I thought it was interesting to share this one because it's the other side of the coin, and the structures of social media and the focus on these online fringe movements by the media could really risk to give them an inflated weight.
Yeah, I mean, it's incredible that how politicized wearing a mask can be. I was in Indiana at the time and was reluctant to wear it sometimes to the store, even though I know it was better for the health, because people look at me, you know, as this liberal, and I really just want to keep everyone safe. But no conversation about conspiracy theories would be complete if we didn't touch on Bill Gates, who really took over the conversation in April. And we had Rory Smith, who is our research manager, look into this, and he and Maddy worked very closely on this. So if you guys want to give us the takeaways from this slide, that'd be great.
Yeah, I can kick it off. So it was interesting and unsurprising that in the poll you guys just took, you cited Bill Gates as one of the kind of top pieces of misinformation that you saw throughout this, and he has been. And as you see in this, what we're looking at in the chart at the top is the total amount of interactions on Facebook groups mentioning Bill Gates or Gates Foundation or Bill and Melinda. And it really peaked in April. It kind of rocketed and peaked on April 13th. And this is, again, unsurprising because I would say this was kind of like peak confusion, right? When essentially the entire world was very uncertain about what was going on with COVID, and there were all types of conflicting kind of guidelines, et cetera. And so what we saw was like many different conspiracy communities kind of converged on Bill Gates at this time. And if you look at the right, you see kind of a list of the top Facebook groups that were kind of posting about Bill Gates throughout this. And if you can see, a lot of the names are very conspiratorial laden, right? So you've got QAnon, you've got the chemtrail groups, you've got some reopen groups. You got some 5G groups, but essentially all these different communities and strands of thinking converged on him and made him kind of the focal point. And what's interesting and what's also unsurprising about this is the reason for this was what people like in the crisis informatics area call collective sense making, which is just the fancy way of saying when people are really confused, that's when the rumor mill starts, and they kind of engage in this process of making sense of a very uncertain situation by creating their own narrative to kind of assert power and understanding in a situation that is quite chaotic. And in this case, they use Bill Gates to do that, because by kind of linking him to everything, they were able to kind of make sense of the situation. So we oftentimes talk about conspiracy communities and we assume there's something wrong, but we're all very much vulnerable to these strands of thinking, especially during kind of crisis situations like a global pandemic.
That's what's interesting in your chart, Rory, is how much overlap there is between the other things we just talked about, whether it's 5G or QAnon, things like that. And we're storytellers. We need to have something explained to us. And if we have an absence of information or shifting information, right? At the beginning, we weren't supposed to wear masks and now we are. It's really hard to explain that to the public and get them to believe it because they believe the first thing at first. But with all four of you, I'm really interested about your methodology. And also, I don't know about you, but when I read a conspiracy theory long enough, I start to think, well, I can see their point a little bit. Have any of you at any point had a roommate or a partner who was like a little worried for you, or maybe you were worried for yourself covering this, that you started to see some of the merits of these arguments? I know Maddy's stewing on it. Go ahead, Maddy.
Yeah, again, I'm just really revealing how fun I am at parties these days, but I find that it's not that I've ever felt myself, falling prey to a conspiracy theory, but I do get frustrated, and this is just pettiness, frankly, but I get frustrated when people hate on the conspiracy theories without enough information. I'm like, yes, what you're saying is right. It is bad and dangerous, but your definition for why it's bad and dangerous is really under nuanced and should include a lot more information and a lot more key figures and data and etc. instead of, which I think speaks to what we talk about a lot, about not leaning on like hateful language to describe certain conspiracy communities, to just be cautious about reducing them down to their craziest elements, because they're often if not resting in a kernel of truth, definitely raking in kernels of truth to make their arguments. So it's dangerous to just write them off.
Yeah, Lydia, you had mentioned something about 5G the other day, and how did you cope with that over a period of the past 6 months? Because you're our go-to 5G person.
Yeah, well, weirdly, where I'm from in England, the Southwest, appears to be like a bit of a hotspot for 5G conspiracy theories. So while, yeah, I don't think I've kind of become convinced, I've definitely sort of been able to sympathize with people who believe these things and share them. And it really does seem to come from a place of concern about health, like alternative health remedies. It does have overlap. But yeah, sometimes with seeing like all of the different groups that shared admins, I think it was me and Bethan, we got to a point where we were kind of getting a bit into like gallows humor and making jokes about it. And I think that was probably when we got a bit in too deep, and I needed to, take a step back.
Yeah, but I think that empathy component really makes you all better researchers. So if there is the absence of empathy, then it's like they're just a bunch of crazies, and then our work, I don't think, is as good as it could be. But thank you for sharing that. I want to open it up to questions from the audience about any of the conspiracy theories that we mentioned, or maybe ones we didn't, or the methodology our team uses. We'll just wait for a minute, and then we can pivot to the protests. All right, let's get started with the next slide and the next team of researchers for protests. I think Maddy's going to stay on. Diara and Keenan are going to discuss the protests. Maddy, I know you don't have a slide, but would you like to kick us off?
Yeah, so I just wanted to share an anecdote about how we found the protest groups, because I think it's a little bit non-traditional and goes to show that like digital anthropology really is all around us. And if you pay attention, you can find some really interesting things. and we should all be paying attention. It's probably the most important part. But I think it was a Friday night, because we weren't working, was just spending some time on Facebook, flitting around, and my just like 18-year-old, pretty apolitical cousin, she's going to school to be an actuary. She does not share a lot of political opinions on Facebook, was posting all this stuff about lockdowns and mental health and how that should be a serious consideration when we decide when and how to reopen, that we can't write off people struggling inside as selfishness and refusal to obey public health orders, etc. And she was sharing all these posts from a group called, she's from Michigan, which important because we saw an anti-lockdown hotspot in Michigan, so I'm sure she was exposed to a lot of it on her Facebook feed. She was sharing a lot of stuff from a group called Michiganders Against Excessive Quarantine. So I took the keywords excessive quarantine and punched them into Facebook, and there were like hundreds of groups with thousands of members from different states complaining about excessive quarantine measures. And then that was, oh gosh, team, I don't know when that was. The time has moved so quickly. I want to say like June, maybe? May?
The first iteration was April, for sure.
Gosh,
and
yeah.
Then, which proper transition, if we want to jump back into the slides, I can detail a little bit about the timeline of those groups and how, most of them started out with the end the lockdown, reopen this state. It was, excessive quarantine. And at the start, around April 15th through April 20th, this is when a lot of these groups started popping up. And they were focused on more of like a revolutionist mindset. So memes that had anything to do with pushing back against the governor, stand up for your constitution. This is how we started our great country. All those posts, mostly visual content, were all aligned within that realm of we need to do something because these mask mandates, these individuals, these governors specifically, these policies that they're coming up with, they're infringing upon our rights, and we need to do more. And then by May, that all transitioned into, you know what? Why should we trust our government? They are pushing these things on us. It's not fair. It's not right. And they were more so focused on what the government was going to do next. It was, they already did this. Now they're going to do that. So just as an example of some of the memes, and we can pop back to one more slide, the slide before. So one that really started to take off was the mandatory vaccination. It was, if they're going to force us to put on masks, what else are they going to force us to do? Why should we trust vaccinations, and why should we trust their testing? Because at the time, especially within the United States, it was a lot of confusion over, hydroxychloroquine. Is this a successful treatment? Which administration or policy or Dr. Fauci, whoever it is, who's supporting what? And because there was that confusion, it was double reflected within these groups because it was more so questions and then pushback. And then on my final slide, when it comes to these protests, by June, these were more so about criticizing media coverage and how the protests around George Floyd and the anti-police brutality protests that were popping up, these groups specifically reopened Virginia and the lockdown, Wisconsinites against excessive quarantine. They were all discussing why the media and the government were portraying the protests, the George Floyd protests, in a different light. And that to them made it seem like that the whole thing was a hoax, that you shouldn't trust the vaccine, we shouldn't trust the testing because look at how the media is covering these protests. And unfortunately, a lot of the content that was in there that started at April began to get overshadowed and then completely flooded out with anti-Black Lives Matter content. And it started getting linked to George Soros. So it went from constitutional to questioning to basically conspiracy theories.
That's amazing. And I guess we should just pause for a second and say our work totally took over into the coronavirus category in mid-March, and then was completely usurped, at least in the U.S., with the protests around George Floyd's killing in Minneapolis. And so from June, for the month of, from end of May to the month of June, that work, that topic usurped everything that we were doing. And so that's how big it was, in my opinion, compared to the coronavirus, a pandemic that's covering the globe, and then this hotspot of protests that we have not seen in decades in the United States. So I think this one, especially the Gene Wilder one, is kind of an incredible comment on that phenomena. And of course, George Soros is the common boogeyman, the anti-Semitic trope that has been brought out since memes have been around. Thank you, Diara, for bringing us that context. Keenan, I know you have something that is state specific to Wisconsin. If you want to talk about that.
Yeah, hi, sure, yeah, so we've been, just to pick up from Diara, so we've been monitoring about 120 public Facebook groups that's set up after March, after some states imposed restrictions, and there are about another 70 private groups. So together, there are about like almost 200 reopening groups. I would say in the American Midwest, like say Wisconsin, Minnesota, and Illinois, Pennsylvania, we've seen some of the most active reopening groups because this area are traditionally the purple states. They have like a center-right governor or a center-left governor. So in this case, in this Wisconsin group, it's called Wisconsinites Against Excessive Quarantine. They have about like 120,000 members, which is like very sizable. So in mid-June, we have seen this meme photo where one of the members claimed that there's a voter fraud attempt by the state. In the US, there's like an ongoing fight over how people can vote, in the November election. And there's a conspiracy theory about that people can like defraud the election if they choose to vote by mail, which is like baseless. But so this post generated a lot of shares in this Wisconsinites group, and that's actually across the board. And like Diara said, so this group, they started as a way to organize protests, to coordinate, but they very quickly diverged into discussing other topics. They are usually very pro-gun, very pro-Trump, anti-vaccine, and we're not surprised by that because we know for a fact that some of this group, say in Wisconsin, in Michigan, in Minnesota, in Iowa, they were started by some very libertarian-leaning, movement or parties or even religious groups. So we're not surprised by, I would say, like the trends. If I can move to the next slide. And so, and we also, through monitoring this group, we also realized that they help fill some of the most memorable misinformation content in the US. Say we talk about hydroxychloroquine. So we have these two examples: the pandemic documentary in May and June, and this group called the Americans for Night Doctors. So through analyzing this group, we realized that they are coming, they are getting a lot of tractions on social media before it became mainstream.
Yeah, and Keenan, you have this giant spreadsheet of all of these reopening groups, and I know every now and then you go in and can you just talk about the one group that went from like 30 members to I can't remember how many, but it happened in a short period of time?
I think it's the group in Virginia because at the time, again, Virginia has become a purple state. It was a Republican controlled state, but now we have the Democratic governor and a Democratic Party controlled legislature. So there's an anti-gun movement in Virginia, and then they kind of just like use this opportunity, to try to recall the governor. And that's not only in Virginia. We've seen in California, in Michigan, people are trying to mobilize a recall movement through these reopening groups.
Yeah, thank you so much. We have a question from the audience if Diara wants to kick that off. And maybe Rory jumps in too, because we do have a system around this. Go ahead, Diara.
So we have a question from Mike Ross, who asks, what methods, if any, do you employ to determine if these are organic human networks propagating conspiratorial thinking or bad actors, synthesizing that content to then destabilize communication and community cohesion? Which is a great question.
Rory, I'm looking at you. Do you got some answers?
Yeah, I mean, it's a great question, and actually kind of aligns with something we've been looking at First Draft recently, which is around the Save Our Children rallies, and what we thought, or essentially what we see and what we've seen through the data is that kind of activity around Save Our Children, Save the Children, and all the associated language kind of spiked dramatically in a very kind of unprecedented way in recent days, specifically in the last week. And when you look at the accounts that are pushing the majority of this content, it's a minority of accounts that are like linked to QAnon related groups. And so they in a sense, they kind of hijacked or co-opted the language and the hashtag behind this. And while we can't say for certain that they've also orchestrated all the rallies that are about to kind of kick off in the US, because there are hundreds at this point of Save Our Children rallies, there is a lot of evidence, and the more we look into it, there's more and more evidence that QAnon is kind of behind a lot of these. A lot of the organizers have links to the movement. So the data can say so much. It can give you kind of leads. It can show kind of suspicious trends, but you always have to look under the hood, and that's when it comes, you know, that you have to do the qualitative investigative research to kind of substantiate a lot of the stuff you're seeing with the data.
Great.
But essentially, we're using a CrowdTangle. It's kind of a social media analytics platform to look at the data, and then we'll go again and look under the hood by kind of like vetting accounts, groups, etc., at a more granular level.
Great, thank you. I think we have a question from Sam that maybe Rory can address in the chat comments area, and we will move on to our next topic. Angela Pimenta, who was the godmother to the Comprova project that we did, a collaborative Brazilian election project in 2018, is on the call, which I'm very excited about. But she asked about hydroxychloroquine because it's such a huge topic in Brazil and frankly all over the world. But if we put up the slide, we have called her our hydroxychloroquine because Jacquelyn found this about 10 business days, I think, before any other mainstream media had found out about it. And Jacquelyn, I don't know if you could talk about this slide and how you knew this might be a thing.
Yeah, sure, Aimee. So if you guys can see on the slide, the date's February 20th. I started monitoring kind of potential treatments for COVID-19 early March, right when the US started to go down on lockdown. And my main platform was Instagram. Even though we're across platforms, I was really trying to get to see what people were saying on Instagram as far as treatments for COVID-19. And I ran across this, this meme. And this is from Twitter, but I originally found it as a repost on Instagram, and it says, chloroquine to other drugs. You cure malaria, I cure coronavirus, we are not the same. And I thought it was funny because I am a Watchmen fan, and it is clearly a composite with some additional stuff added to it. But I'm like, what is this? It cures malaria, and now it cures coronavirus? Like, let me look more into what chloroquine was, because that's what they were calling it at the time. And in the next slide, you will see that I could go back further in February using CrowdTangle and see that a Chinese media website was putting up that chloroquine was a cure for COVID-19. And then moving into the next photo, there's another woman who was in Africa, also in February, making very broad statements and very convincing statements that chloroquine would be the cure for COVID-19. And then moving into, I saw this around the world, and so moving into America, not even a month later, we have President Trump officially hit, kind of teasing with the idea, flirting with the idea of promoting hydroxychloroquine, but on March 21st, he officially endorsed it and said it was going to have a real chance to be the biggest game changer. There's also another picture which got a ton of engagement of Democratic Michigan State Representative Karen Wissett. Ms. Wissett said that chloroquine saved her life. And so President Trump retweeted this. She was on Fox News a bunch, and she was praising both Trump and hydroxychloroquine, which was huge. And in the next slide, I kind of looked at how hydroxychloroquine was being received in different communities. And one of those communities was the African-American community. There was a lot of talk about using hydroxychloroquine in nursing homes, in prisons, forcing people to probably take it, these conspiracy theories that people were going to be forced to take this drug that was possibly deadly. Because although hydroxychloroquine is, you take it for malaria and you also take it for lupus, people with COVID taking hydroxychloroquine, the mix was proved to be possibly deadly, right? And the FDA has now completely disproved of the drug outside of a hospital setting. So as that information became privy to people, we have people talking about, are they going to experiment on Black people? In the next picture, you see someone saying that they actually, in fact, were experimenting on Black people in nursing homes. And so a lot of that chatter started to happen and proliferate across the internet.
Yeah, I mean, and you know, this had real life consequences for people who were who need that drug for lupus and malaria, right? There were shortages, and that because there was no proven efficacy of this, to have leaders like Bolsonaro in Brazil and like Trump here in the U.S., both of them claiming to take it at certain points, right? Didn't Trump say he was taking it as a prophylactic for COVID?
Yes, he did. He definitely said that. Also, hydroxychloroquine was bought in bulk by multiple U.S. states. New Jersey, one of them, just completely wiping out the supply. There was a lot of, when you looked into different lupus groups, which I was also looking into, you could see a lot of like fear and being like, I need to stock up on this medication because it's going to be gone. And, you know, it's a life-saving thing for me. So all very true.
Yeah, and we'll talk about this a little more with the vaccines, but hydroxychloroquine is cheap and it's not a vaccine. So people who are anti-vaccinations or have vaccine hesitancy, we're saying, you know, you're not hearing about this because the big pharma wants to own you, basically, or the government wants to make you a guinea pig to make vaccinations mandatory. I think Seb was tracking the proliferation of hydroxychloroquine in France. Seb, if you want to talk about Didier, Dr. Didier, did I pronounce that correctly? Okay.
Yeah.
Take it away.
Thanks, Aimee. So similar to the US, hydroxychloroquine has kind of been at the heart of the coronavirus crisis in France. It's been a huge talking point, and the main expert proponents of the drug continue to this day to be featured regularly on mainstream news channels. But it really is Diara who's a highly respected infectious disease specialist who's really been the central node in the hydroxychloroquine debate ever since the pandemic hit France. He began to treat patients with what is now known and referred to as the route protocol, which has been a very useful keyword in our searches and our monitoring online. So it's essentially a combination of hydroxychloroquine and the azithromycin antibiotic in hospital, which was referenced by Trump. He's been idolized ever since, vehemently supported online. He's actually kind of become a cult figure, as you can see on the meme in this slide, which is one of many fan memes that kind of circulates across social media to this day. Dozens and dozens of Facebook groups in support of the professor have been created since early March, and some have actually reached hundreds of thousands of followers, sometimes close to 500,000. And kind of all the data we're collecting and our daily monitoring really indicates that this is where the majority of the narratives and the information dynamics around hydroxychloroquine have really played out. But interestingly, before these groups were created and kind of gained all this following, most of the information and support around the professor and hydroxychloroquine was actually happening on pre-existing large yellow vest groups who continue to be very active communities and have picked up particularly over the last few months. And this seems due to the fact that these movements really share in common a deep mistrust of the current government as well as mainstream media outlets. Dr. Raut is seen as a figure that is challenging conventional wisdom of the government scientific council, and he's also perceived to be unfairly treated and demonized by certain mainstream media outlets. And so the main narrative that you referenced there, Aimee, the fact that hydroxychloroquine is this cheap drug that is being suppressed by kind of corrupt governments and corrupt media outlets because big pharmaceutical companies stand to lose out on future profits. That's been the crucial one in France. But more problematically, these narratives have kind of, in some cases, evolved to claim that vaccines are only being developed and promoted to make profits, and that governments are simply being corrupted by big pharma's interests at all times. So on that basis, and sometimes, you get more far-reaching ideas like, the idea that vaccines are being pushed by elites ahead of hydroxychloroquine because they're a means to track populations or even depopulate populations. And so anti-vaccine misinformation, which I'm sure we'll come back to later, has really become an even greater issue in France and other Francophone countries.
Thank you for that. We also have Jaime talking about chlorine dioxide through Latin America, just another killer drug, so to speak. Jaime, why don't you take it away?
Right, so this journey of people in drinking industrial bleach sort of started for me with this huge story about Viviana Canosa, who is a political talk show host in Argentina. At the closing of one of her shows, she actually took a swig of a bottle that she said had CDS in it. And that's sort of what prompted me to dig a little deeper. And I found a tweet of hers that said, #AndreasKalker, I drink, #CDS. So I was wondering, who is this guy? And as I was digging deeper and deeper, I found a group in Bolivia, Aimee, that was studying CDS and who had supposedly done trials. Also, doctors in Bolivia who were pushing for the use of CDS. And there were also a lot of protests in Peru happening. If we can go back to the other slide. Happening in Peru, a lot of pro-CDS protests that were huge, that were covered by national outlets. And the connection between all of these, I really shortly found out, was actually that man, Andreas Kalker, who claims to be a German scientist. He's really not new on the block, but his latest endeavor is to push for the use of CDS to treat the coronavirus and COVID-19 symptoms. And also this group that he's a member of called Coalición Mundial Salud y Vida, or COMUSAV. And in the next slide, we can get a little bit more into the specifics of those groups and Andreas Kalker. So basically, what came about through a lot of my research is that there really were two forms of, there were really two ways that CDS was given a lot of legitimacy. One of them was through abusing the trust of medical professionals, and the other was through religious figures. COMUSAV has mainly a lot to do with that aspect when it comes to medical figures. And that first image, you can see there's a group of 3 people. You can barely see the third one. But the third one is Priscila Calisperis from Bolivia. She's an orthopedist who is a huge proponent for the use of CDS in that country. And 2 of her colleagues, one of them is holding Andreas Kalker's book. The other one is holding an ID from COMUSAV. And then right below is a priest, a pastor, excuse me, called Oscar Gutierrez, who was hawking CDS in one of his live shows, which actually was this was particularly a very, very popular one. He got 1.77 million views. And on the back, you can see Andreas Kalker's name is written on the whiteboard, and also the bottle that he's actually selling has Andreas Kalker's name literally written all over it. So these are 2 of the biggest figures that I've seen in Latin America who are really pushing for this use. And I think it's really important to understand how how Andreas Kalker and these doctors and these pastors have sort of created this trifecta where you can really abuse the trust that people have for these authority figures. And I think similarly to hydroxychloroquine, and how, as Seb mentioned, the key narrative in all of this is that CTS is being suppressed because there would be a lack of profits for pharmaceutical companies, and corrupt governments who are in cahoots with these companies are actually enforcing these rules. That bottle of CDS that you see right there, word on the street is it'll last you a couple of months because you have to dilute the solution. And I've seen a bottle on online marketplaces go for around 600 Mexican pesos, which is like $30, if I'm not mistaken, 30 American dollars. So in comparison, it's pretty cheap. So that might also make it seem a little more accessible to folks who are sort of not as prepared to pay for the healthcare or for a vaccine. And that also just really goes into a lot of theories about vaccination. This is very similar to that last point that Seb had made.
Thank you. We'll have Bethan and Ali talk to us about vaccinations, because that is kind of a nice segue into that. Thank you, Jaime, for explaining that non-cure cure. Hi, guys. What do you want to tell us about vaccinations related to coronavirus?
Hi. Yeah, well, so we've touched on it a bit already now about the idea of all nations or mandatory vaccinations, but just to delve into it a bit more, because it really keeps the imagination, I think in the UK in particular, but also in Australia, and as Diara was saying, in the US, and also in France to a certain extent. So, you know, the introduction of these social distancing regulations, they brought with them a perceived feeling in some communities that there was a crackdown on civil liberties. And that kind of coalesced around the idea that mandatory vaccines were going to be introduced. And this is like really interesting from a misinformation point of view, I think, because there is that kernel of truth element in that, like, some governments are publicly discussing or talking about the idea of a COVID vaccine, a future COVID vaccine potentially being compulsory for certain things. And then also there's the problem, which is that the vaccine for COVID doesn't exist yet. So it's quite hard to debunk claims about something that doesn't actually exist. But so just to kind of go into the UK a bit, I remember this example really clearly because it was, I would say it was one of the earliest examples that I saw of the mandatory vaccine and coronavirus link in the UK. So it was towards the end of April, and it was essentially saying that a change in legislation meant that now the government could enforce mandatory vaccines. And so it kind of caught my eye anyway, because, you know, suddenly when loads of people start talking about a piece of legislation, it's quite unusual, but also I wasn't seeing it reported anywhere. So I was kind of immediately, my interest was kind of piqued by that. And it turned out that it was a complete misunderstanding of legislation, which obviously is very easy to do if you don't have that kind of expertise. But it was picked up by public figures, like, you know, Katie Hopkins is very well known. And also, you know, David Icke, who came up earlier, was also kind of like talking about mandatory vaccines in this context. And, you know, the video was shared widely, and it's still on YouTube. It still has, I think it has over 300,000 views at the moment. But what was really interesting to me was that it was shared not only widely in the UK, but also in the US, Australia, in particular, with kind of like the warning of, this is coming to you soon. Look at the UK, this is coming there. This has happened there, it's coming to us next. And people kind of looking at other countries and comparing legislation like that is always really interesting. And also
about the pandemic is to see how, as the pandemic encroaches into another country, that they get the similar narratives. I don't know if Ali, you have some comparisons from the other countries that you were looking at outside of the UK?
Yeah, I think the way just preventives and vaccines have been sort of viewed in other parts of the world outside the Western quote unquote world is very interesting. And I think geopolitics and nationalism have played a fairly big role. So the first time I remember seeing this, or connecting those dots anyway, was in March. And so that was when the sort of preventive that was being peddled, basically cow urine, was being peddled as a preventive to the coronavirus in India, which was weird, but cows are, for those of you that don't know, cows are sacred in Hinduism. And so that was just part of this huge wave of Hindu nationalism that we're sort of seeing in India. And very similarly, like in another example of this kind of indigenous remedy, indigenous vaccine really, was the president of Madagascar basically came out with a drink called COVID Organics that he said would prevent you from getting the coronavirus, and I think it was also a cure. I think they weren't sure. I guess it did both pretty much. The interesting thing about that was that he went on to say that if this drink had been created by a scientist in Europe, it would have been much better received, especially by the WHO. And I think, as you'll see on the next slide as well, even the conversations around vaccines themselves are very different, like traditional vaccines. So again, that element of nationalism is very, very prevalent. In India, earlier in July, there was this announcement made by the government body saying that the coronavirus vaccine that India was developing would be ready by August 15th. August 15th is India's Independence Day. So very, very clearly an element of nationalism there. And finally, the most recent, I guess, example is the Russian vaccine that was announced a few days ago. The way that was viewed in the West, of course, was very skeptical, like, have they even done their tests? How are they vaccinating people? Whereas in India and in parts of Southern Africa, it was viewed very, very positively. And that, again, harks back to our relationship with Russia. So even towards the end of the Cold War and even after, India has always been very close to Russia, whereas the US and Russia have been traditional enemies. So it's very interesting to see how all of these geopolitical and national issues sort of combined.
Yeah, I mean, that's what's been amazing about coronavirus. It seems that it has toppled what had been traditional authority figures or places that we trust. We've seen that kind of crumble. Maddy and Rory will talk next about that in our last 5 minutes. Just reminding Rory and Maddy, we don't have long to discuss the crumbling of the WHO and other institutions, but please give it your best shot.
Yeah, absolutely. My video is not working for some reason. So there we go. Cool. Fantastic. There it is. Yeah, so essentially a big part of all this has been a loss of trust in institutions generally. And I will focus on just WHO because it's obviously one of the biggest, if not it is the biggest public health institution in the world. And we'll kind of track how trust in the institution was eroded. But it's important to kind of highlight that the WHO was already seen as pro-China early on, specifically in Hong Kong and Taiwan. And that was based off of the WHO essentially lavishing tons of praise on China's efforts to be transparent. Their arguments, I won't go into the arguments, but essentially that's what sparked that. And then problems then ensued because the WHO did issue contradictory guidelines throughout the pandemic. And again, this kind of harks back to what I was talking about before with kind of the sense-making process. When people are issued contradictory guidelines, it creates mass confusion. And we know when there's mass confusion, this is when the rumor mill starts, right? And Maddy will talk about kind of the communication system or the weak communication system in a bit, or right after this. But essentially, the WHO itself arguably facilitated and caused a lot of these data voids and vacuums, which were filled in by misinformation. And a lot of that misinformation ended up being tied around Bill Gates, as well as China, as you can see from the meme there. There was tons of chatter about the WHO being, it was being called the Wuhan Health Organization because its ties were so close to China. So already from the very beginning of the pandemic, trust in the organization was in question, and that was specifically in question in the US, right? We saw a lot of the kind of libertarian medical freedom movements rallying against the WHO because in the US, it's specific to the US because we don't like to be told what to do, specifically certain movements within the US, right? And the WHO was effectively telling us to wear masks, telling us to do all this stuff, and there was obvious pushback from certain communities in the US. And then, of course,
and that was from institutions, but I wonder if Maddy can also speak about Fauci and how his star was rising, and so that is a ripe opportunity for somebody to grab it and degrade it. So take it away, Maddy, for Fauci.
Yeah, well, so similar to Bill Gates, honestly, from a marketing perspective, it's just a lot easier to galvanize a community around one specific figure. So if you're upset with how the health system has played out for you, and you've had bad experiences, or you're confused about recommendations, or it's hindering your ability to participate in the economy, whatever it may be, it's a lot easier to make a meme where you put devil horns on Fauci than it is to explain the decades-long eroding of, you know, trust in the medical community and how that comes from mismanagement, etc. So I feel bad for the guy, but it is kind of an incredible exercise in marketing that it's a lot easier to organize a community around one specific keyword, and in this case that happens to be Fauci. So it doesn't necessarily even really have a ton to do with him specifically. Like, sure, people pick apart his words, etc., but he is just sort of the figurehead for this movement. And yeah, we see the same thing with Bill Gates, that if you are in the upper echelons of the government or philanthropy, and have been for a while, you're going to have connections to a ton of people, and all that stuff is available on the internet. So that's ripe for conspiracy too, that you can dig up financial records connecting Fauci to pretty much anybody you want to, just because he's been around for long enough. Yeah, so it is just a perfect storm to promote these kind of ideas.
Thank you guys for that. We have one question, so I'm going to bring back the whole team, and Diara will post the question to, or pose the question to the team.
I will indeed. All right. So this is from Jingnan Ho, if I'm pronouncing that correctly, and apologize if I'm not. But I wanted to know, how do you go about reporting the impact the streams of misinformation online has on the ground? Like, how does misinformation translate into people's behavior? Such example as the protest. A lot of times it's hard to analyze and quantify that information, because what someone posts online, what they may register for an event or sign up for a rally, but it doesn't necessarily mean they're going to attend it. They may post and say, I'm not wearing a mask, but when they go outside to like the 7-Eleven, they may have a mask on. So it's hard to really quantify what that impact is, at least from the research that I've done.
Yeah, but I do think it's important to be reporting on impact. Like, I think a lot of people in the misinformation sphere like to report on cause and origins and people who are promoting certain misinformation. And like, when I think about I think we had a question about bot network stuff. And when it comes down to it, if a bot network is promoting misinformation that's causing harm on the ground, that's the same impact on the community as if it was actual people promoting that misinformation. So looking, I guess that I'm kind of avoiding the question, but looking at the impact, I think, is important and often under considered.
Great. Well, I want to thank everybody on the call, our team, especially for the amazing research you do and the insights you brought to the past 6 months of the infodemic. I'm not sure where we'll be in the next 6 months, but we will be back hopefully on a call to explain what we've done. As you can see, a lot of our work is based on keywords. And when we are looking for something, Jacquelyn said she was looking for chloroquine at first, which led her to hydroxychloroquine and influencers in that space. Jaime indicated the same thing. Those are marketing terms, and we use marketing tools like CrowdTangle to look up and find other communities and who the origin stories are of those, if we can. But anyway, thank you guys for tuning in, and we appreciate your attention today. Thank you.